At the federal level, trade policy is in the spotlight as President Trump orders a review of U.S. tariffs. Meanwhile, in North Carolina, key bills on healthcare costs, retirement savings, and child care tax exemptions are moving through the General Assembly. Here's what you need to know. You're watching the Matthews Area Chamber Advocacy Update. I'm Brian Francis, and it's February 17th, 2025. Starting out with federal news, President Trump signed a memorandum Thursday directing federal agencies to study how U.S. tariffs compare to those of other nations. The goal is to move towards reciprocal trade. The order instructs the Commerce Department and the U.S. Trade Representative to review possible changes, but it does not at this point impose any new tariffs. Now, that eases concerns from some of our foreign trading partners, at least for now. For businesses, this brings both uncertainty and potentially some opportunity. Companies that rely on imports could face higher costs if tariffs increase. Meanwhile, export-driven businesses might see retaliatory tariffs from trading partners. But for domestic industries competing with heavily protected foreign markets, this could be a win. As federal agencies complete their reviews, businesses will need to stay alert for potential changes in trade policy that could impact costs and market access. Now, shifting to North Carolina, several key bills affecting business are moving through the legislature. First, Senate Bill 24, which focuses on transparency in state-mandated health insurance requirements. Now, supporters say the bill increases disclosure around the cost of mandates and ensures that any new mandates are balanced by removing existing ones. They believe this will help businesses by providing more predictability and affordability in employer-sponsored health care, which is critical for workforce retention. However, others express concerns that the bill could limit access to important coverage without delivering meaningful cost savings. They worry that removing mandates could degrade the quality of healthcare plans or prevent the coverage of important health services not currently covered. This debate will continue as the bill, which passed the Senate on Wednesday, now moves to the House for further consideration. We've got another bill to watch, House Bill 79, the North Carolina Work and Save Act. This bill would create a state-facilitated payroll deduction IRA for employees of small businesses and self-employed individuals who don't have access to a workplace retirement plan. Now, many small business employees lack savings options, and this program could help. The bill includes $1 million in startup funding over 2 years to get the program up and running. And finally, we saw House Bill 115 introduced. It addresses property tax exemptions for child care facilities. If passed, licensed facilities used exclusively for child care would be fully exempt from property taxes. Those with mixed-use spaces would qualify for a partial exemption, while facilities under probation or with revoked licenses would not receive any exemption. The goal is to support child care providers while maintaining accountability. We'll continue to track these and other issues impacting the Matthews business community as the session progresses. Until next time, I'm Brian Francis, and this has been the Matthews Area Chamber Advocacy Update.